You yourself are a therapeutic nutritional counselor. You understand this quite well, the idea of nutrition. What are you telling your patients on how they should be eating to protect and help the health of their teeth?
It's interesting. That to me is the biggest difference between traditional practice and really what I again call health based is, you come into the dentist and you have an exam and the dentist says, you've got a cavity. Let's get you scheduled. Let's get you back. Let's get that filling taken care of. You come back, you get the filling done, and then you go away and you plan to come back in 6 months again and do it all over again. But was there ever a conversation about what caused the cavity? And how do you make sure that you don't get another cavity again in 6 months? And also, what about the filling material that they put in the tooth? Is there going to be a problem with that, like for the rest of you? And are there other things that are in the mouth already that could be an issue? I mean, these are just so many different questions that we just never address. We never address any of those pieces. So for me, I talk a lot about what causes a cavity. And so what have you been told that causes a cavity? Because this is what everybody's been told. If you get a cavity, what did you not do enough of?
No, you didn't brush, you didn't floss, and you ate lots of sugar, those kind of things, right?
Yeah, right. Just brushing and flossing and eating lots of sugar. So none of those things are wrong. They're just incomplete.
Yes.
They're just incomplete. That's true. You should brush your teeth. You should floss your teeth, and you shouldn't eat a lot of sugar. That's actually true. What the sugar does is it feeds the bacteria that are in your mouth. They love sugar as much as you do. And they eat that sugar. And when they eat that sugar, they actually excrete. Their byproduct is acid. That acid then dissolves the minerals out of the tooth. So that is what causes a cavity. The bacteria then crawls into the holes that acid created. They eat more sugar, they drop more acid, they make a deeper hole, and eventually they crawl deep into the tooth. So the concept about there's actually an interesting dentist in the 1930s named Dr. Weston Price. And anyone who's ever studied nutrition or, even any kind of alternative medicine has probably heard of Dr. Weston Price, but not everybody knows he was a dentist. So he was really quite dismayed because in the 1930s, there were so many children getting tooth decay. Interestingly enough, there's more children today than there were in the 1930s, but he was very dismayed about this. And so he wanted to really get to the bottom of, he was actually the head of the American Dental Association research department. He wanted to get to the bottom of what caused cavities. So what he did is he actually found indigenous societies throughout the world. And what indigenous society meant was basically someone who hadn't been touched by the modern diet. Today's what they call SAD, standard American diet. These societies were still eating what they'd been eating for centuries. So he found them, and what he did is he studied them, and he said, what do your teeth look like? And not only that, what do your bones look like? What does your structure look like? What's your health? Are you able to resist disease? All of these things. And then the cool part is he had a camera. He could take pictures, which I think was just this. He was in such a sweet spot, He could not only research this, but he could take pictures of it. So he'd take pictures of these people, the way their faces were developing, all these things. And what he found is there was a direct correlate. It was interesting because some of these people that had the best dental health were like some were eating butter from grass-fed cows and some were eating blubber from whales. So they weren't eating the exact same food, but what he found is that the constituents of those foods were the same. And he found that people who had better teeth had 10 times more fat-soluble vitamins in their diets. So what are fat-soluble vitamins? They're the vitamins A, D, E, and K. And he just found straight across the board that people who had better dental health, better overall health, had 10 times the amount of those vitamins. So when I start talking to people about this, we even get to what do those vitamins do? Well, those vitamins act like gatekeepers for minerals into the cell. Because when you talk about a tooth, you can actually create a cavity-resistant tooth. I always joke that my brother had braces when he was in junior high, and it was my father's a dentist, and my father did the braces, and they were like the first of those newfangled white braces. Okay, so we did white braces. They weren't the metal ones; they were porcelain, but they were brand new. Probably had been out like a year. And what we didn't realize is that they would take on the color of whatever he ate. So they weren't metal, but they were soon orange and green and whatever he had eaten for the day. So it was really obvious if he brushed his teeth or not. And I'm pretty sure he did not brush his teeth for 2 years. Were so disgusting in those braces. He got the braces off and he did not have one cavity. So if brushing your teeth was the only component here, he would have had a mouthful. And I see this so many times. I'll have a family come in. Dad, no tooth, no cavities. Like we got like 3 kids. One kid has like 7 cavities. The other 2 are fine. And then mom has a mouthful, and every single pregnancy, she has a bunch more. And she's so ticked off because dad never flosses. Dad doesn't even take care of his teeth, and he has no cavities. So she's just like mad. I take care of my teeth so good, and why do I get so many cavities? Obviously, there's more to it than just brushing your teeth. So nutrition is one of them. What those fat-soluble vitamins do is they actually grab the minerals out of basically the circulatory system, and they plug them into the cell. Now, teeth are made of minerals. So we need minerals to be able to keep our teeth and have them be cavity resistant. So if the gut is not absorbing minerals properly, then you will often show up with tooth decay.
Mhm.
If the body is using those minerals elsewhere. So mom just had 3 babies, nursing, pregnancy, lots of minerals going to grow those babies, grow those babies' bones. Mom didn't have enough for both she and the babies. So now her body is sacrificing her teeth for the sake of the baby. So when you talk about nutrition, I just say, okay, how can you get more minerals? Not only minerals, getting more minerals, how can you absorb more minerals? Is your gut actually working properly? Let's make sure it's actually working properly. So it's actually absorbing the things you need. And are you eating those vitamins that are necessary to get the minerals into the tooth itself? So, sure, I give people specific dietary advice. Okay, eat more of this, but it's going to be based on those things. Let's eat more minerals. First of all, high mineral content foods, and let's eat foods that have fat-soluble vitamins. It's tricky because a lot of them are animal products, and a lot of people shy away from those today. And a lot of our animal products aren't as good as they used to be either. Pasteurized milk doesn't do the same job as raw milk does.
Mhm.
So it's a little tricky. So sometimes you have to supplement. So vitamin D, vitamin K supplementation is one of the things that I just tell people, you just may have to do this. If you're going to keep a healthy mouth, you just may have to supplement vitamin D3 and vitamin K2 forever, because it's going to help you get minerals into your teeth. We also talk about putting minerals to the outside of the teeth. That's a whole nother talk. If we want to talk about fluoride versus minerals in teeth, we can talk about that too. But that's really what I tell people is let's look at what all the factors are contributing to tooth decay. And most of it has to do with actually the minerals you're eating and the minerals you're absorbing.
Yeah, it's a really good point. If you just look around and you even look a little bit at history and you see those Aboriginal colonies in Northern Australia that would have beautiful teeth, or eating rugged thing, chewing a lot, biting into things, not this kind of processed foods that's so soft and easy. And then you get into James Nestor's work on Breathe, how mouths are getting smaller and more crooked teeth. And we have to take wisdom teeth out now and all these things. We've really gone backwards a lot when it comes to our teeth's health. And then you talk about nutrition and the confusion that big food has given us, that fat is bad, sugar's not that bad, carbohydrates, and then you keep going and it's always something, and everyone's always confused about these things. When if you just go back a little bit and say, hey, quality first, let's put nature first, let's try and eat a good diet that's rounded everything, and just do that, our teeth will absolutely benefit them from that so much.